C-section and normal delivery, nutrition for lactating and expecting mothers, stages of labor and childbirth, preparing to breastfeed, postpartum mother and baby care, and recordings of all the session is available for free on our app. Now about our team, we provide 24/7 instant pediatric support through WhatsApp communities and online consultations. We have a group of 50 plus doctors and experts, and we have helped over 5 lakh of parents in 56 plus countries. And we are very well helpful in, we have supported over 15,000 mothers in their breastfeeding journey because that is the most common challenge the mother faces once the baby is delivered. Apart from this, we also provide baby nutrition, massage, and sleep programs and vaccination packages with pan-India access to the doctors at discounted rates. Now, apart from these webinars, we are also conducting couple mass classes, which is ideal for those who are in their 28 to 36 weeks of pregnancy. In these 6 live sessions will be provided to you to help you to prepare in your labor, childbirth, and postpartum care of baby. Each session is of 1 hour and is happening on each alternate days, and recordings will be shared to you the next day. So, in case if you have missed the Tuesday session, we will give you the recording by Wednesday, and you can watch the recording and attend the Thursday session. A WhatsApp group with the expert will also be provided to you, wherein you can ask any follow-ups related to childbirth or any doubt you have. This starts for rupees 999 per couple. Now, many people ask that I am doing yoga. Do I also need Lamaze classes? Yes, you definitely need because they are not the substitutes. They are complementary to each other. While yoga helps you in your physical and mental well-being, Lamaze helps you in childbirth preparation and pain management. Now, these are the 6 sessions and the topics which will be covered by in each session. A complete detailed brochure will be shared to you once the webinar ends. Now, these are the testimonials of mothers who have had normal delivery after attending the classes. Nivedita ma'am had a baby girl delivered by normally, and she was able to execute plan D without the perineal tear. So, what happens in Rama's classes is that the expert guides you and helps you to prepare different kind of plans so that in case if plan A doesn't work, you have plan B. If plan B doesn't work, you have plan C. And if C doesn't work, you have plan D. Also, you can see here, Prithvi ma'am also had normal delivery when her husband used the massage techniques that were taught in the class. Priyanka ma'am also had a normal delivery. Then this was the recent one of 16th May wherein Surabhi ma'am delivered normally. These are few feedbacks from the session. So if you are someone who is looking forward to a normal delivery, we will suggest you the Lamaze classes. You will get 6 sessions of 1 hour and recordings will be provided to you and you will have the access of recordings for 3 months. And this starts for rupees 999 per couple. The new batch and the timings will be mentioned on the website and the link to register and the complete brochure will be shared to you once the webinar ends. Now, I would like to invite Dr. Era to start with the webinar.
So, hello everyone. I welcome you all. I am Dr. Era. I am a physiotherapist and childbirth and lactation educator. And my own journey of pregnancy and breastfeeding has motivated me to help other mothers in their journey. Because through my pregnancy journey, I understood one thing, that when we know the process of pregnancy, that how the labor progresses, when we know the techniques, when we understand that what precautions we have to take, so what happens, it gives us confidence. Okay, and it also makes our journey of pregnancy and labor very stress free and very easy. So that is what motivated me to help others mother, and that is why I am here also. So this is all about me, and let's start with today's webinar. So first of all, I just want to ask you all that why do you think that why you are here? Why do you need these childbirth classes? You can just type in chat box and just let me know that why do you think you need childbirth classes? What expectations do you have? So, yes, obviously, we are here for the normal delivery. And yes, of course, that one mother mentioned that, you know, new mothers are literally, they are scared that what happens at the time of labor, what type of pain it will be. So we have mixed emotions, we have mixed reaction regarding this labor. And that is why you need childbirth classes, because through these classes, you are able to manage this thing. So, through these childbirth classes, what we do, we basically make you understand that your body is naturally designed to give birth to your baby. Everything is designed inside your body. Your body knows when, how, and what to do. It is just that you need to support your body. And how you will support your body? You will be able to support your body only when you will understand that how the labor progresses, how what precautions you have to take in mind, and also that what posture you have to maintain. So all these things make you understand the process of labor. Just hold on, mothers. Just hold on. Okay. Sorry for the interruption. The first thing is that when you understand that how the labor progresses, what things you have to keep in mind, it gives you confidence, because when you get evidence-based education, evidence-based guidance, it makes your journey easy. Also, when you understand that how the labor progresses, what coping techniques you have to use at the time of labor to ease your labor pain, it gives you confidence and it keeps you relaxed at the time of labor. And yes, when you are prepared for something, you are very confident. And when you are confident, it makes your journey easy. So that is why we need these childbirth classes, basically to understand and to gain confidence that our body is naturally designed to give birth to the baby. Now, just a simple question. What kind of birth would you like to have for your baby? Type 1 if you want vaginal, type 2 if for the C-section. Of course, vaginal. We are here for the vaginal delivery, for the natural delivery. Yes. But for natural delivery also, some of the factors are there which actually increases the chances of vaginal delivery. So what factors are there? So these are the factors which are actually in your control. So the first factor is level of activity throughout pregnancy. So by level of activity, I mean that when you are maintaining regular routine in the sense doing regular walks, doing gentle low impact exercises, taking care of your postures. Okay. So when you have these things in your daily life, actually it keeps you fresh, strong, energetic. That is number one. Number two, having well balanced nutrition. Of course, you need to have a well balanced diet during the pregnancy. Why? Because you need to create a reserve of energy all around your body, inside your body, for the growth of baby, of course, and also after the birth of the baby for the breastfeeding journey. So you need the reserve of energy. But most importantly, you need proper nutrition so that you have enough energy to deal with labor. Okay, so this is the importance of nutrition. That is why it is very important that you should have colorful diet. Color of proteins, carbs, vitamins, minerals, everything should be in your diet. Then the third thing comes ability to manage pain during childbirth. So the truth is that it is not like that if you will attend these classes, your labor pain will be painless. No, it will be painful. Labor is a painful process. But through these classes, you will be able to manage the pain. You will be able to use the techniques to ease your labor. So that is the thing comes that how you will manage your pain at the time of childbirth. That is very important. And when you have the knowledge that how you will manage the childbirth, how you will manage the contraction pains, and how the labor progresses. It progresses stages wise. Okay, so how the labor progresses, when you know that how the process is done, so it gives you confidence and you are ready to deal with this labor. And the last thing comes the weight and position of the baby. So this is something which is 50-50 in your hand. So if I talk about the weight of the baby, yes, of course it is in your hand by eating good diet, well balanced diet. Okay, if I come to the position of the fetus, so position of the fetus is something which is 50-50% in your hand. So how to maintain your baby properly in your in your womb, inside you? For that you need to maintain the proper posture, which we will be discussing today only. So weight and position of the fetus is something which is 50-50% in your hand. Factors which are not in your control are the emergency medical cases, which will be discussed in the upcoming webinar by our gynec. Now here comes the baby position. Now you please type in chat box what type of position is required for the baby to be born naturally. Number one, occiput. By occiput, I mean when the baby's head is down. Breech, when the baby's head is up. And transverse, when the baby is in lying position. Correct. So, for the baby to be born naturally or vaginally, it is very important that your baby should be in head down position. That is occiput position. But in this head down position also, there are two types of position. One is called as occiput anterior and one is called as occiput posterior. Now, what is occiput anterior? What is occiput posterior? And among these two positions, which is the best position for the baby to be born naturally, that I will explain you now. Divya, can you focus the screen on me? Thank you. So, if you all can see, this is the female pelvis. The female pelvis is just in the same manner the way I am holding this. The female pelvis is like this. Now, if I am talking about the occiput posterior position. So, by occiput posterior position means when the baby's head is in downward position and baby's back is facing the mother's back. This position is known as occiput posterior position. And what is occiput anterior position? When the baby's head is in downwards position, but baby's back is facing mother's belly. The way I am holding this doll. Okay. Now, what is the difference between both positions? So, what happens when your contraction starts? Okay, when your baby is coming down. So, what happens when your baby is coming down in occiput anterior position? Your baby enters the birth canal. Birth canal means these bony protuberance, your pelvic area. So, when your baby enters in this area, your baby has to, bend, twist, and turn to pass through this area. But when your baby is coming in occiput posterior position, what happens? Your baby's spine is facing your spine. So what happens when your baby is trying to get down? Your baby's back puts the pressure on the mother's spine. So what happens? It makes the baby stuck. Baby is not able to pass through it because baby is getting stuck. Okay, and due to which what happens to pass through it, your baby starts putting the pressure on your spine. Mother feels immense back pain at that time because baby is not getting space due to the mother's spine, and mother gets the back pain because baby is putting lot of pressure on mother's spine. So along with contraction, along with labor pain, mother is having this back pain also, and which causes immense pain, and due to which it becomes very difficult for the mother to deal with that pain. Okay, but if the baby is in occiput anterior position, the position in which the baby's spine is facing the mother's belly. So what happens when your contraction starts? Your baby is coming down. Your baby enters the birth canal. Okay. Now baby has to bend to pass through it. Now what happens? baby is getting lot of space because there is nothing to stuck the baby. Your baby is getting lot of space. Your baby is able to bend, twist and turn, and with twist and turn and with each contraction your baby is able to born. So this is why position matters a lot. So this is what the difference is between occiput anterior and posterior position. In occiput posterior position, your baby puts the pressure on your spine, due to which you feel immense back pain and due to which you are not able to deal with contractions. But in occiput anterior position, your baby gets the lot of space. Your baby is able to bend freely, your baby is able to do twists and turns, and your baby is able to pass through the birth canal. But for this, you have to keep few things in your mind, that how to maintain this occiput anterior position. So first of all, number one, whenever you are sitting, it is very important that you should sit straight. Your back should be well supported, straight and well aligned. Okay, first thing. Second thing, avoid sitting in leaning backward position. Why? Because when you sit in leaning back position, what happens due to the gravity, your baby's this part is heavier. So due to the gravity, your baby turns to occiput posterior position. So that is why it is very important that whenever you are sitting, sit straight so that your baby is well aligned in pelvis. So sit straight, avoid sitting in leaning backward position, avoid any position in which your knees are above your pelvic area, the way I am sitting. Avoid sitting in cross leg position. Okay, whenever you are sitting on the bed, whenever you are sitting on the sofa to watch TV, anything, even whenever you are sitting in the car, it is very important that you should place something behind your back, at least one or two cushions behind your back, so that your back is well supported. And also you can also put pillows behind your shoulder so that your pillow is supporting your shoulder and back muscles. So these are the things which you have to keep in mind to keep your baby well aligned in pelvis. And also add leaning forward positions, leaning forward exercises in your daily routine. Okay, because when you lean forward, your baby due to the gravity remain in this position. Okay, so these things you have to add in your daily routine so that your baby is well aligned in pelvis and your baby is in good position, that is occiput anterior position. Next please. Now here comes the route map of labor. So I know you all must have heard different stories about the labor from different people and also through movies and series also. Some mothers must have heard from different mothers that she was in labor for 24 hours. She was in labor for 2 or 3 days. Okay. Some mothers have picked different imagination about the labor due to the movies. Because in movies and series, what they show us? They show us that one lady is lying on the bed, two, three people are surrounding her. They are holding her hand. She's shouting like hell. And then she's fainting. She's sweating a lot and she faints. But mothers, it is not like that. Labor is a slow process and it progresses slowly. That is stage wise. So labor has stages and every stage has different pattern. And in every stage, you have to deal with contractions in a different manner. So the first stage is called as early labor and this is the longest phase. Okay, at this point it can take 8 hours also, sometimes it takes 12 hours also, and at this point only your contractions become regular. Contractions become regular, I mean when you start feeling the contractions in a pattern. For example, I am taking your class and suddenly I feel pressure down here in my abdomen. Sudden tightening in my belly. For 45 seconds, it is tight, full pressure. Now after 45 seconds, nothing is happening. For another 20 to 25 minutes, nothing is happening. Everything is normal. I continue to take class, and suddenly after 25 minutes, again feel that tummy tightening. My whole abdomen is tight. It is tight, or I feel the pressure for 45 seconds, and again it relaxes and nothing is happening for the next 25 minutes. And again the same thing happens after 25 to 30 minutes. Now at this point, I notice that this thing is happening in a pattern, which means it is coming after every 25 to 30 minutes. So that is what is contraction. When you start feeling contraction, when you start feeling pressure in your abdomen in a pattern, like they are coming after every 25 to 30 minutes. So that is the point you are in early labor, and that is the point that your contractions have started. So there is nothing to get panic, because it is the longest phase, and this will take several hours. It can take 8 hours, it can also take 12 hours, or it can take a day. But in this full procedure, you will only feel this tummy tightening, nothing else. No pain is there, only pressure is there. So this is what happens in the early labor. Now, active labor is the stage when this tummy tightening is little intense, because your labor is progressing. So at this point, you feel the same thing. The pressure is same. The tummy tightening is happening, but it is happening in short gap. It in short gap, I mean when you feel tummy tightening and pressure after every 5 minutes. So that is the reason mother feels the pain more at this point. So basically, active labor means 511 rule. It is the point at which you should go to the hospital. So 511 rule means when your contractions, when you are feeling pressure after every 5 minutes, for 1 minute, and since 1 hour. So when you have this pattern, then you should go to the hospital. If your hospital is 15 to 20 minutes away. But if your hospital is 35 or 40 minutes away, then you should go to the hospital when your contractions are coming after every 10 minutes. Okay, and after active labor, there is a transition phase in which we feel the pushing of the pushing feel, and at that point, your baby is coming down. So this is how your labor is stages of labor are divided, and once your baby is delivered, after that your placental delivery happens. Okay, so 511 rule means when you feel the contraction, when you feel the pain, when you feel the labor, after every 5 minutes, for 1 minute, since 1 hour. Okay, so this is the 511 rule. Next, please. Now we will be talking about the signs of labor. So basically, pre-labor is the stage which happens at least 15 to 20 days before your due date. So how mother will feel at this point? False contraction. So what do you understand by false contraction? False contraction is something like, for example, mothers who are in their uh, 37th or 36th week. Sometimes what must be happening with them when they are walking, or even when they are sitting? Sometimes they feel tummy is getting tightened, full tight, and it is like this for few seconds, and after that it relaxes, and then you are not feeling anything for another 1 day or 2 day, and after 2 or 3 days you again feel the same thing. So this is what is false contraction. We also call it Braxton Hicks. So basically these contractions are preparing your body for the delivery. Okay, and it is important also. Second comes sudden burst of energy. So sudden burst of energy means mother who was feeling tired, a few days ago, mother was feeling very tired. She was feeling breathlessness. She was getting tired. She was not able to, carry herself properly. But suddenly, mother is feeling very energetic. She is making space for the baby. She is preparing things for the baby. She is, she is walking fast. So this is called a sudden burst of energy. And why it happens in mother? Because due to the lowering of the belly. So what happens when you in the initial time when you are in second trimester, your by the end of the second trimester your belly is like a shape of a watermelon, just beneath your chest level. That is the reason that mothers feel breathlessness. Okay, but once you are enter the third trimester, when you are 35 weeks pregnant, your belly is suddenly lowered. So why your baby is moving down now, and that is the reason mothers are feeling little energetic. They are not getting tired that much, and also they are not feeling breathlessness. Why? Because there is lowering of the belly, and also mother is feeling little light down there. Strong nesting behavior means, like when birds are about to lay eggs, what they do? They start preparing the nest for the baby. So the same way, mother starts preparing the space for the baby. She will start preparing the space for the baby, buying important things for the baby, preparing her hospital bag, preparing a bag for the baby, something like that. So these are mother instinct, which mother will feel herself. Then comes the loose stool. So mother who was complaining since a few days back regarding the constipation, suddenly she is having change in her bowel movement. She is having frequent bowel movement, proper bowel movement. There is no constipation. So these are the signs of pre-labor. And also one more thing is that is discharge of mucus plug. So during the pregnancy, we all mothers have white discharge, but this discharge of mucus plug is something, it is also white in color, but its consistency will be more. It will be very thick, and its amount will also be, good amount will be there. So if you go to the washroom and you see something like that, so there is nothing to get panic. It is just discharge of your mucus plug, and it is just that your body is getting ready for the labor. So these are the things which mother will feel. But what will happen inside your body? So what is happening inside your body? Your cervix change. So cervix is the opening of the uterus. So for example, this is baby and this hand is the cervix. Okay, so this pointy part is basically the cervix opening. Okay, we call it cervix. And when your baby, when it is time for your baby to come, what happens? Your cervix starts softening. By softening means, from from this pointy, your cervix will come like this. It will be like a thin layer of paper around your baby's head, and we call it cervix effacement. And also you will start feeling those Braxton Hicks, that false contraction, that tummy tightening and all. What a partner can do? Yes, at this point it is very important that partners and family members ensure that mother is taking proper rest, she is eating well, and also keep her motivated, keep her confidence level up, and good positive talks should be all around her. So it is very important that taking care of mother is very important at this point. Next please. Now here comes the early labor signs. So first sign about the mother is cramping and discomfort. So basically, if you remember, I told you that once your labor starts, you will start feeling the contractions in a pattern. That tummy tightening will happen after every 25 to 30 minutes. So when you start feeling that thing, that means your early labor has started, means your contractions have started. Second thing, mother will feel lower back pain. Why? Because these contractions come from back to forward, back to forward. So that is also normal because your baby is coming downwards that time, and that is the reason you are having these changes inside your body. Also, now as you all know that the contractions have started, and it will take a lot of time for the baby to come out, but you know that the contractions have started, so it is a good news for the mother, because right now she will be able to manage those contractions very easily, very nicely, because nothing is happening, only tummy tightening is happening. So at this point, what is there? Mother is chatty, she is sharing news with her friends, with family, that I am having contractions, they are coming in a pattern. So mother is chatty, she is excited. Okay. And what is happening inside your body? So as I told you, your cervix is like pointy, your effaces. Effaces means when your cervix is like a thin layer around your baby's head. Now at this point, what will happen? Your cervix dilation will happen, which means your cervix will start to open. So with each stage of labor, your cervix starts opening with each contraction. And at this early labor, your cervix opens up to 6 centimeter. And at this point, your baby starts moving downwards with each pressure or with each contraction. What partners can do? Again, ensure rest, proper hydration. Your mother should eat well and provide distraction. Distraction means not only talking about the contractions. Distraction means talking about other things also, doing walks and making the situation normal for the mother. She should not get panic because there is nothing to get panic. It is a slow process and it is totally fine because you will not feel anything at this point. Okay, next please. Now, after early labor comes the active labor. So how you will understand the active labor? Suddenly, mother who was very chatty, who was smiling, suddenly her expressions are changed. Now she is looking little tense. She is no longer chatty. And she is also having the pain in a, for longer period of time and in short interval. So at this point, it is 511 rule. That is, it is time to go to the hospital. When your contractions are coming after every 5 minutes for 1 minute, and this is happening since 1 hour. So at this point, go to the hospital if your hospital is 15 to 20 minutes apart. Next, please. Now, emergency signs means when you should rush to the hospital. So first thing comes the water breaking. So, water breaking also has different pattern. So you have to keep one thing in your mind, that is coat. Coat means C for color, O means odor, odor means smell, A means amount, T means time. So what do you understand by the color? So when you notice the water leakage at home and when you see the color of the water, if it is colorless, then nothing to get panic. If it has, brown color or it has black color, then in that case, you should go to the hospital. And at this point, when the color is brown or, black, in this case, C-section generally happens. Then after color comes the O. O is odor, which means smell. Generally, water doesn't have any smell. But if you feel any foul smell is coming, then you should rush to the hospital. Then comes the A, amount. By amount means that what amount of water leakage is there. So if you are having drop by drop leakage from, drop by drop leakage of water, then in that case, nothing to get panic. You can go to the washroom, take shower, clean yourself, wear pad, eat something, keep yourself well hydrated, and you can go to the hospital after doing all this. But if the amount is like a gush, a fast flow of water, okay, it is like 150 or 200 ml of water is just leaking every time, then in that case, you will take the same position the way you can see on the screen. You will lie down and you will keep your knees flexed. Nothing to get panic in this situation also. It is just that you just need to lie down at this point and keep yourself well hydrated, and then you can go to the hospital. So this is the thing which you have to keep in mind if your water breaks at home. Second thing comes lightheadedness, dizziness. Then comes the persistent headache. If the headache is persistently is there, it is not going even after taking rest or medicine, then in that case, you should rush to the hospital. Vaginal bleeding, of course, by its name, it is telling the red sign. Vaginal bleeding, if you see red discharges there, bleeding is there, then yes, you should go to the hospital. Sudden swelling or puffiness of hand, feet or face, in this case also rush to the hospital. Visual disturbance, if you feel that you are not able to see properly, blurredness is there, and flashing is there, in that case also go to the hospital. Then comes the severe abdominal pain, the pain which you are not at all able to bear, in that case rush to the hospital. Then noticeable reduction in fetal activity. if you feel, if you notice that you have not noticed the baby kick since 1 hour, then in that case, after checking that since so long there is no movement, no kicking is there, in that case you should go to the hospital. And then last comes the severe pubic pain. Severe pubic pain, see, pubic pain is something which during the pregnancy mothers do have. Why? Because your baby is full time putting pressure on this pubic area. But if the pubic pain is too much that you are not even able to turn the position, you are not even able to walk, then in that case you should go to the hospital. So these are the some signs which you have to keep in mind, that you have to go to the hospital. So what to do in the hospital? So in most of the hospital, they prepare you for the labor through Lamaze classes. But if there is nothing like that, in that case, you should join offline or online Lamaze classes. The way we have online Lamaze classes in Babynama, there are workshops in which we prepare the mother, in fact couples, for the childbirth. We explain the process, we explain the different positions which they will use at the time of labor, and also the pain management, that is using different coping techniques. Next please. Now here comes the labor position. So there are 6 to 7, there are more than 6 to 7 positions which you use at the time of labor to ease your labor. But at this point, I will demonstrate you one position, that is standing position using the chair, which you can use at the time of labor. So when you are having intense labor pain, okay, first of all, what you will do, you will stand with your legs apart, okay, and what you can do, you will take the support of the chair or anything, chair or the wall. You will just lean forward on it and you will do sideways motion. Left, right, left, right, left. So what is happening when you are doing this? First of all, when you are leaning forward, your baby, due to the gravity assist, if your baby is in posterior position, your baby will be in occiput anterior position. Second thing, if your baby is in occiput anterior position, yes, of course, your baby will be in well-aligned position. And also, due to the gravity, your baby is, descending downwards. And third thing, due to the legs apart, you are giving more space for your baby to come downwards. Another thing what you can do at the time of labor, you can place your foot on the chair and you can do this forward, backward, forward, backward motion. So when you are moving like this, when you are swaying forward, backward, again due to the gravity, your baby will be well aligned in pelvis, your baby will descend downwards, and also because you are widening this space, you are giving much more space for your baby in the pelvis to pass easily. And of course, it eases your labor pain. So this is the one position which I demonstrated you that you can use at the time of labor to ease your labor pain, to ease your contraction. Because by changing position, by swaying sidewise, it actually eases the contractions because there is no direct pressure on your spine, and also it gives more space to your baby. So that is how the positions help you at the time of labor. Next, please. Now here comes the comfort measures. So there are more than 12 comfort measures which we discuss in our classes, that which help you in, in easing your labor, to help you deal with labor. One coping technique which I will be demonstrating today is the vocalization. So first of all, I will ask you all to do this thing with me. So all of you just scream or shout and tell me how you are feeling in your abdomen. You can type in chat box when you are shouting and screaming. What is happening in your abdomen area, in your belly area? How you are feeling? Just shout and tell me. tightness. Manasvi is feeling relaxed when she is shouting. Manasvi, shout again and tell me. Okay. Now you all tell me, do you think that if your baby has to pass through the birth canal, do you think this area should be tight or this area should be relaxed? Tight or relaxed? Relaxed. Yes, of course. So which means if at the time of labor, if you will shout, it will, what it will cause, it will constrict your body the way you felt right now. It will constrict your body will get tight. When we shout, our muscles constrict, contract. But if same thing will happen at the time of labor, then what will happen? Your baby will not get enough space, okay, to pass through the labor, to pass through the birth canal. So that is the reason it is important that at the time of labor, instead of shouting, you should vocalize. Vocalize in the sense, when the pain is coming, instead of shouting, you should do oh, or you should hum. Now all of you just do it and tell me how you are feeling down there. Just say oh, or you can say hum. Calm. Others also, please tell me what difference is there. Relaxed, relaxed. So that is what vocalization helps. So for example, if mother is having pain, so what she can do along with position. For example, I am having pain, 511 rule. I am having pain after every 5 minutes and I am having intense pain. What I can do, I can lean forward, I can sway myself, and instead of shouting, I can say, oh, So what happens? Yes, of course, when we are in pain, it is important to vocalize. But instead of shouting, we can vocalize ourselves by saying oh or hum. So what will happen by this? Vibration, relaxation, and also you will be able to vocalize yourself. Instead of shouting or screaming, you will vocalize like this. So this is one of the comfort technique which I demonstrated you. There are more than 12 which we discuss in the classes and tell mothers that how they will use different comfort techniques at each stage of labor, because labor progresses stage wise and it is a slow process. So here are the testimonials by the mothers who were benefited by the class and they were able to manage their labor pain, their contraction only by using, coping techniques, positions and all. And this is what they have shared here, if you can see in your screen. So we have advanced childbirth workshop. It is, there are 6 live sessions, 1 hour each, for 2 weeks. In class 1, we cover the route map of labor, in which we tell that how the, labor progresses. In class 2, we talk about the comfort measures. Comfort measures means we discuss about the coping techniques, that what coping techniques we use at the time of labor. In class 3, this class 3 is full with partners. In this, we discuss about the labor positions that and coping techniques, and we demonstrate it and we make partners to do along with us. Then in class 4, we talk about the pros and cons of the intervention. In class 5, how to take informed decision and postpartum care. And in class 6, we talk about the preparing for hospital and creating a birth preference plan. So this is about our childbirth workshop and this is all about us. Thank you.
Okay, so now we are open for question answers. You can raise your hand if you have any question. I will give you permission to speak. Yes, Pallavi, I see. Hello.
Hello, hi Pallavi.
Yeah, hi. I just wanted to know, whether there will be yoga classes and exercise classes will be there or not.
See, yoga classes, yoga classes that is not there in Lamas. This is only about the Lamas classes in which we do talk about the exercises and positions which you should do in regular basis, and also the position which you should maintain to keep your baby well aligned with pelvis.
Okay. There would not be classes like that.
Particularly yoga classes you are talking?
Yes, yes.
No, no, no. That Divya
Okay.
can tell better.
Okay. Okay. Yeah. Thanks. For yoga classes, we have different experts. If you want to enroll in that, you can personally text me once the webinar ends. I will let you know. Okay. Sure. Anyone has any question, or you can raise your hand. It would be great if you can raise an unmute because we won't be able to take questions in the chat. Ruchika ma'am, you can unmute.
Yes.
I'm giving you the permission. Yes, Ruchika ma'am, you can unmute and ask the question. Yes, Kanika. Yes.
Ma'am,
Hello.
hello.
Yes, Kanika. Hi.
Hi, ma'am. Actually, I want to ask why cross-leg position to be avoided while sitting, like on bed or on sofa.
See, cross-leg position you have to avoid because our ligaments are these ligaments which are surrounding in pelvis, not during the yoga. In on the bed, we avoid cross-leg sitting because sometimes what happens by default we go to the lean forward, lean backward position. During the yoga, you can sit in cross-leg position because we do different asana at that time. But when you are sitting on the bed, cross-leg sitting position is to be avoided because by default we go to the backward position, which leads to your baby to go into the occiput posterior position. So if you are sitting on the bed, it is always better to keep your legs straight and keep your back well supported and sit straight. And these ligaments which are around, the ligaments which are surrounding the pelvis, this pelvis is very flexible in pregnant ladies. So what happens when you sit for a long period of time in cross leg position, these ligaments get stretched or strained, and then you get pain in this pelvic area. So that is why it is important when you are sitting for a longer period of time on the bed, you are watching something or doing something, it is better to keep your legs straight and keep your back straight and well supported. That is the only reason. Sitting cross-legged during the yoga, it is something different that you are doing for a particular period of time for maintaining a asana. Got it?
Oh, okay. Thank you, ma'am.
Most welcome.
Hi, ma'am. Hello.
Hello. Hi Ritika.
Hi, ma'am. Does centile have any effect during labor, ma'am?
Placenta.
Centile, 11th centile, ma'am. They
11.
say that the baby is in small size.
See, this baby is in small size. It actually depends that what is the size of your pelvis. Okay, so yes, sometimes it has little effect to pass through the birth canal. But for that, it is always better to consult your gynec for this thing, because every doctor has different protocol about all these things. So yes, if baby is little, if your baby is big or small, it everything depends on the size of your pelvis. So that is something which your gynec will tell you, that what is the size of your pelvis. So for example, I give you one example. So for example, if the pelvis is small, but the baby's head is large, so in that case, it becomes difficult for mother to, pass the baby through the birth canal. But if the baby is small in comparison to the your pelvis, so what happens? It's sometimes difficult for baby to get fit into it. So growth of the baby matters a lot, and for this, your gynec will tell you better. Ritika, can you hear?
Thank you.
Most.
Okay, so I guess no one has any more questions. Thank you, Tara ma'am, for
Most.
such a great session on a Saturday afternoon. Your final words of advice to the parents who are still connected.
So yes, I would like to tell all mothers that mothers, see, our body is naturally designed to give birth to the baby first of all, and it is always better to take proper guidance for this, and it is always better to have evidence based knowledge about everything. So to make your pregnancy journey, beautiful, easy, to ease your labor contractions, it is better that you maintain proper regular activities in your life. And also it is better to, take guidance from someone so that your journey becomes easy, and stay stress free and happy. And we are here to help you if you feel that you want to make your childbirth journey easy, and to ease your labor contractions, and to get rid of all those myths and visualizations, careful fearful visualization. So we are there to help you, we are there to guide you. So this is all about us. Thank you and all the best, and take care.
Thank you, ma'am. You can leave if you want. If anyone has any doubt or any question regarding our couple Lamas classes, you can ask me. You can raise your hand, I will give you the permission. Yes, Sarva ma'am.
So, ma'am, actually, talking about this couple Lamas class, my husband is not here, okay? He's into Navy, so he keeps traveling. So, what can be done in that case?
He can watch the recording. We will share you the recording, and you can we can also share it with your husband, so he can watch the recording. Yeah.
So, we do not have to attend the sessions, we can go through the recordings.
Yeah. If you're available on the day of the session, you can attend, and if you're not, a recording will be provided you in both the cases, so you can access that as per your convenience.
And these recordings are available only on your app, you said, right?
So the Lamas recordings will be available on your email ID. We will ask you which email do you want the recordings to be shared with. It will be available in your email, in your Google Drive basically. So you can access
Okay, thank you.
whenever you want. Yeah.
Okay, thank you.
Anyone has any more questions, they can ask. So you can see these are the 6 sessions which will be happening in other classes. The third and the sixth session will be a partner session wherein we will advise you that your partner also joins, because it will help him also to understand what to do and what to expect in the label. Complete detailed brochure and the link to register in the Lamas classes will be shared to you once the webinar ends. If you have any question, you can ask me. I'm here. The next batch will start from this Tuesday. I will share you the link in the group which you are connected with. You can go on the website and check and register there. And yeah, it is advisable for the pregnant women only, basically from 28th week of their pregnancy. So yeah, I guess no one has any more questions. Yeah. So no one has any more questions. Thank you for joining on a Saturday afternoon. It was great. Now I will end the session. Thank you so much.